Bleeding gums. What are the causes of bleeding gums? Because bleeding from the gum is very, very common. It can be pretty annoying to the patients, especially when sometimes we hear patients saying, I got up in the morning, doctor, I spit and I saw blood in my saliva, which can be quite disturbing to the patient, especially when you get up in the morning and you spit out, the first thing you see is blood in your saliva. It can be quite disturbing. So what are the causes of bleeding gums? What can be the reasons for it? How we can avoid it is what we'll look into this video. Hello, this is Dr. Arun from Pearls Dentistry. We run our dental centers at Chennai, Raja, Namalipuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel. We have a whole bunch of videos coming out explaining on dental health and awareness. Now let's look at bleeding gums now. Generally, if you look at it, our mouth and especially the head and the mouth are highly innervated. What do I mean by highly innervated? There is a lot of blood supply coming to the facial structures, and mouth being an important part of the face, gums also receive a lot of blood supply. So when gums receives a lot of blood supply, so there are chances in which the blood supply to the gum can get compromised. When I say compromise, either because of an inflammatory process or because of a traumatic process, this blood supply can get compromised, leading to bleeding gums. So usually when you look at a healthy gum, the healthy gums are usually pink and firm in color. So when we use our thumb and press against the gum, usually it's firm, resistance to the pressure that we apply, and usually it's pink in color and doesn't bleed. It's a sign of healthy gum. It means that the gums are not inflamed, there is no swelling in the gums, the capillaries inside the gums are not fragile, they are well made of. So it's a sign of healthy gums. What happens when an inflammation happens? Now when an inflammation happens, there is a lot of fluid that collects in the tissues. There is a lot of, because of the fluid, there is swelling in the tissues, and also newer blood vessels, newer capillaries form, which are very fragile in nature because they are newly forming. So that those capillaries do not have strong walls. When they don't have strong walls, easily those walls can break, the blood inside those capillaries can come out, leading to bleeding gums. So this is the science behind that inflammation, the color change that happens because of the swelling that is there, and why it bleeds. Now what causes this inflammation? So we should understand the commonest causes bacterial toxins. Why does bacterial toxins happen? Of course, our mouth harbors a lot of bacteria. Harmful bacteria as well as good bacteria are there in our mouth. So when we eat our food, there is food in our mouth, there is minerals from our saliva, and then bacteria on top of it. All these triad of things work together and then form a deposit on the surface of the teeth. An initial stage it's called plaque. As it develops, it's called calculus. Now these bacteria in these deposits releases toxins over a period of time, and these toxins, what they do, these toxins are very inflammatory in nature, harmful in nature to the gums. So now gums take up these toxins and shows an inflammatory response. It's a sign of body fighting against the infection that is caused by the bacteria. It's a sign of infection. So and the body tries to fight it by causing inflammation. Now in an initial stage, if you go meet a doctor, by a simple procedure we can do a cleanup, like a scaling and a prophylaxis, we can restore the gum to normal health. But when we leave it to an advanced stage, then what happens? Gums can start receding, can affect the bone inside, eventually can lose to tooth mobility and tooth loss. Now, so to prevent this, it's very important that we attend to this gum issue at a very early stage. So apart from just twice a day brushing, flossing, our regular maintenance checkup and regular cleaning is very, very essential. One other thing what is important is bleeding gums can be caused by trauma. What do we mean by trauma? Usually it's either a foot trauma or toothbrush trauma. So when we are brushing, if you are not focusing on the brushing, our attention is not focused on the work that we do, eventually can lead to a harmful way by which we brush our teeth. The brush, either the bristle or the brush head, can poke against the gum and then can cause bleeding gums. That is one. And of course, certain kinds of food can be sharp, and when we eat can tear up the soft tissues that is there in our gums and can also cause bleeding. This is an acute stage. But usually the chronic ones or the persistent gum bleed is what is the most common thing. This is tooth related thing. So I hope this video explains the commonest cause of gum bleeding. And then if there are any questions, please do ask in the comment section below if there are. And until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.